Congestive heart failure occurs when the heart fails to pump an adequate amount of blood to meet the body's needs. Fluid accumulates in the heart, the vascular system, and the lungs. In the lungs, this causes pulmonary edema. With each beat of the heart, about 60 to 80 milliliters of blood is ejected to meet the body's needs. In congestive heart failure, the heart muscle begins to lose its ability to pump efficiently, and not enough blood is ejected with each beat. The lack of oxygenated blood will cause dyspnea, tachycardia, and tachypnea. This is the body's attempt to compensate for the decrease in blood flow. The heart cannot take in more blood. The fluid then begins to back up in the venous system, leading to neck vein distension and edema of the feet and lower legs. In congestive heart failure, only one side of the heart may be affected. In right-sided failure, there will be further congestion in the liver and the spleen, causing abdominal edema. In left-sided failure, fluid backs up into the lungs, causing pulmonary edema, a life-threatening emergency. In addition to severe dyspnea, there may also be blood-tinged sputum. Congestive failure leads to an enlarged heart, distended neck veins, liver and spleen congestion, abdominal edema, lower leg and ankle edema, and pulmonary edema. Treatment is aimed at reducing the fluid congestion by the use of diuretics, restriction of fluid, and salt intake. Cardiotonic drugs are also used to slow and strengthen the heart.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition. Page 273. Left heart failure. What is the reason for pulmonary edema as well as paroxysmal nocturnal dyspnea to happen in a patient with left-sided heart failure? The reason this would happen is because in left-sided heart failure, there would be an increase in pulmonary venous pressure. So the blood that's coming to the heart from the lungs, there would be an increase in pressure in that blood. Now, because of this, this would lead to a pulmonary venous distension, and because of this, it leads to a transudation of fluid. And all this fluid backs up into the lungs, and therefore you would have pulmonary edema and paroxysmal nocturnal dyspnea. What are some of the cells that you would also find in the lungs in a patient with left-sided heart failure? In a patient with left-sided heart failure, you would find hemosiderin-laden macrophages, which are known as the heart failure cells, and these would be present in the lungs. Why does orthopnea happen in left-sided heart failure? In left-sided heart failure, the reason you would have orthopnea is because there would be an increasing venous return in supine position, which would exacerbate pulmonary vascular congestion. What is orthopnea? Orthopnea is a condition when there is a shortness of breath when a person is in supine position, so they could only breathe comfortably when they're standing or sitting erect. For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high-quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.